Well, hey there, it's Dr. Kevin here, and in this quick video, I'm going to reveal a common cause of mental health issues that most doctors miss and or don't look for. You know, when I'm making this video, it is Brain Injury Awareness Month, but no matter when you're listening to it, you can benefit from it by just obviously watching the entire video or sharing it with someone that you care about. You know, one of my missions is to change the way the world looks at depression, and there is a common cause of depressive symptoms, again, that most doctors miss. Sometimes doctors don't even ask about brain injuries. That's right, brain injuries. Did you know that having one TBI, traumatic brain injury, can double your risk for suicide ideation? That's right. And it could lead to depression, anxiety, ADHD, brain fog, and it's a risk factor for cognitive decline. It's a huge problem, traumatic brain injuries. And in this video, we're just going to talk about prevention. In future videos, I'm going to talk about how you can actually address them, ways you can treat them, other resources, people, professionals to look for, even books, supplements, diets, etc., etc. We're going to cover a lot on brain health in the future, but first and foremost, if we're going to prevent things like depression, anxiety, cognitive decline, mental health issues, we have to prevent brain injuries. And the best way by doing that is just being smarter and trying to avoid them. You know, when I was a kid, there's no doubt I had ADHD, but they didn't have an acronym for what I had. But if they did at the time, they probably would have labeled me adrenaline destructive disorder. That's who I was. I was an adrenaline junkie as a kid. I used to jump off of roofs. I used to ride my BM bikes off of ramps and hills without a helmet. So that leads me to number one. The biggest cause of traumatic brain injuries, or brain injuries from anything really, are falls. So if you are being asked to get up on your roof, to clean gutters, to put up Christmas lights, make sure you tell your loved one, hey, Dr. Kevin said no getting on the roof. In fact, I remember a few years ago, my neighbor who's in his 80s was on his roof. And I said to my wife, please call over there and get him off the roof. If they need help, I will do it. In fact, I'm going to tell my wife next Christmas season, I can't get on the roof, honey, to put up the lights because I got to really take my own advice. So again, stay off of roofs. Leave that to the professionals. Pay them to do that if you need something done. Another thing is please stay off of ladders. Step ladders are never a big reason for falling. People fall off ladders all the time. If you don't feel steady, don't have a good ladder, please don't get on one. So stay off ladders, stay off your roof. Falls are a big cause of traumatic brain injuries. Number two on the list for most common causes of traumatic brain injury are car accidents. That's right, getting hit by a car, you hitting someone else. Here's the thing. When it comes to brain injuries, people think you got to be hit in the head. You don't. You know, your brain is as soft as butter or jello, and your brain actually moves inside your skull. So when you have whiplash, when your head goes forward and snaps back, you don't even have to hit anything. Your brain is moving inside your skull. In fact, there is a common type of brain injury called contra coup. Basically what this means is as your head goes back, comes back forward, your brain actually comes to the front part of your skull, and that's where some of the damage occurs, even though you may hit the back of your head. So motor vehicle accidents are a big cause. Please be safe. I'm not saying that you should wear a helmet in the car. In fact, did you know helmets aren't even designed to protect your brain? Now, we need to be smart about it when it comes to sports and other activities, riding bikes, snowboarding, etc. We should wear a helmet because it does protect at least our skull and our scalp from injuries and from damage. So again, let's just cover these common causes, and there's one left that I need to talk about. But again, one is falls. Protect yourself, stay off roofs, stay off ladders, make sure you're steady on your feet, right? Number two, please be careful when driving your vehicle. And then the third one is getting hit by an object or hitting an object with your head. Think about sports. These are common causes, but not the only cause of a traumatic brain injury by getting hit by something. We think about soccer players, right? This is multiple hits on the head, and it doesn't have to be hard. It's really the amount of times you're hitting your head. Football is another one. As an adolescent and a young adult, I played competitive football for 10 years, and I have brain images to show you the damage that has occurred through those years. So if you are going to play a sport, please wear a helmet. Please protect yourself. as best you can. And if you think you have hit your head, or even if you didn't hit your head and you think there may be something wrong, for instance, if you get into a car accident, please go to the emergency room and at least check to make sure you don't have bleeding on the brain. So you have to check in with medical professionals as soon as humanly possible. And then, of course, watch yourself after those accidents do happen for days and weeks down the road, because what happens is your brain becomes inflamed. Did you know that your brain cannot feel pain? That's right. Your brain can't feel pain. In fact, they've had open skull surgeries where they were actually protruding into the brain with sharp objects and people can't feel them. That's right. You can feel it on your scalp and your skull, but not your brain itself. So when your brain is inflamed, things start to occur out of the norm, meaning brain fog, you can't think clearly. You may have a headache, you may get nausea, you may have blurred vision. If you have those, check in with a medical professional. But down the road, this inflammatory cascade, if you will, starts, and sometimes it doesn't stop in the brain. It can continue for months, even years down the road. So if you start to become depressed, you have a hard time focusing and paying attention, you have anxiety, etc., that's when you need to seek help. And again, in the next video, we are going to talk about some people that you can go see to help you if you have a brain injury. We're going to talk about diets, nutrition, and exercise that are all great for your brain. But again, this video is all about prevention. So again, let's just cover these really, really quickly. Again, please stay off the roof, stay off ladders, okay? Most importantly, if you do get into a car accident, check in with a physician, go to the hospital to make sure you don't have any bleeding on the brain. Lastly, please protect your brain, your scalp, and your skull by wearing a helmet when playing sports. And just use some common sense. If you don't think you should be doing something, whether it's a sport, an activity, please take caution when doing that. Anyway, hopefully this video has served you well. Hey, don't forget to subscribe to this channel. Again, we're going to have new videos coming out every single week, sometimes multiple times a week. And if you need more help, you can just go to my site, kevindobrinsky.com. You can see it up there in the banner where I have additional free training for you. Anyway, I want to thank you for spending some time with me here today, and I'll see you next time. And until next time, I'm Dr. Kevin. I want you to eat well and be well.